So thank you everybody for coming. Welcome to IPHA's Third Thursday Lunch and Learn web series organized by the IPHA Education Committee. We like to dedicate this time every month to sharing our successes and maybe some of the detours that it took to get to those successes, because those can help us grow too. The point is to connect, learn, strengthen the voice for public health in Iowa, which of course is one of the main missions of IPHA. If you are a member of IPHA already, we thank you for that. If you're not yet a member, we invite you to join and help us carry out that mission. You can do that on our website at iowapha.org. Today, we're talking to Lezlie Mestdagh from the Iowa Heart Center Foundation, and she'll share about Sudden Cardiac Arrest Awareness Month and the overall work of the foundation. Before we get started, a couple housekeeping items. Your microphone should be muted and your video turned off during the presentation. This will help us keep enough bandwidth so that everybody can see and hear. You can put your questions in the chat while she's presenting, and then we'll have plenty of time towards the end for questions. You can unmute, turn your cameras on, whatever you'd like for that, or just put them in the chat. The session is being recorded. It'll be posted to IPHA's YouTube channel, where you can find all of our archived previous lunch and learns. But now I'll turn it over to Lezlie so you can introduce herself and tell us about the Iowa Heart Center Foundation. Lezlie?
Thank you. Good morning, everyone, or afternoon. I guess it's right at noon, so we'll go with afternoon. How about that? Well, I am excited to be here today and to share with you about the Iowa Heart Center Foundation. I would say that a vast majority of you may or may not have heard of us, but we have been around since the 1990s. I have been with Iowa Heart Center Foundation for 2 years now. And our vision is to become Iowa's leader in the promotion of cardiovascular health. Our mission, as you can see, is that we're committed to improving heart health education and dedicated to the prevention of heart disease. And how do we do that? So we work to improve the heart health of all Iowans. And we have 3 main priority areas of community outreach and education, promising prevention programs, and clinical education support. Community outreach and education is what I'm doing today, and sharing information with all of you as members of the Public Health Association here in Iowa. We became members, I don't know, Lena, maybe a little over a year ago, I'm guessing, and we're proud to be members and excited for this opportunity. We also work with community education and outreach. And then one of our promising prevention programs that I just wanted to share today, because I think it's just a great program, and you'll see the picture there, is that we partner with Iowa State University and their switch program. And we work with schools across Iowa to help students switch what they do, view, and chew. And this program is free for all Iowa schools to participate. There's 12 weeks of curriculum that is provided to them, training, education modules. And we started this strategic partnership a couple of years ago now, and fully implement it in last school year, where students receive heart health lesson plans to learn what their heart is, how it functions, and how their lifestyle choices will impact their heart health. We also do clinical education support, and through that, we partner with Iowa Heart Center, who is the organization who founded us. Those physicians of Iowa Heart Center wanted to have that philanthropic arm of their work here in Iowa, and so we offer clinical education support both internally and externally. We have a nursing scholarship program, so nurses from throughout Iowa and throughout accredited nursing programs can apply for those scholarships. We also support continuing education. This past year, we had our 30th annual Cardiovascular Today conference, and that's open to medical professionals from throughout the state and beyond, if they choose to attend, to continue their education around heart health. So you can see that we've been very committed to that education piece for a long time, and more of our work is continuing to expand in that prevention side of things. Today, I'm going to focus mainly on just heart health education and awareness, and that priority for us. And it's timely for us to be here this month and today to talk about sudden cardiac arrest. This is Sudden Cardiac Arrest Awareness Month, and you can see that since 2008, it has been a nationally recognized observance month. And I wanted to share just a bit about why this is personally so important to me. I think when I talk to people about heart health, I think every single one of us on here probably has the ability to share a personal story. Most of us will have somebody in our family or a close friend who has either had a heart attack or lives with a heart disease or struggles with one of those high cholesterol, hypertension. It is so common that it is very unlikely we don't have our own personal stories. But I just thought I would share mine briefly with you. I have 3 kiddos. They're 12, 8, and 10. And our middle son was 3 days early, and he was 10 pounds, 2 ounces. So I'll let that set in for a second, because that always takes everyone by alarm. I had a 10-pound baby, and I was fine. He, on the other hand, ended up in NICU. And he had what was called newborn pulmonary hypertension. And they also treated him for pneumonia, amongst a few other things. And when he was in NICU, they were, of course, running lots of tests. And one of those was an echocardiogram, where they saw that he had an enlarged heart, or a thick heart muscle. And at the time, they just tried to share with us that they thought it was probably because he was so big at birth and he would just outgrow it. So we were in NICU for 12 days. And then he was set to go to a follow-up cardiology appointment 3 months later. Well, every single week, sometimes more than once during that week until that appointment, I was at the doctor with him. He just struggled with a lot of things. And when we got to the cardiologist and they did another follow-up echocardiogram, they discovered that his heart was in fact still enlarged and had that thick heart muscle. So they went ahead and diagnosed him with what is called hypertrophic cardiomyopathy. And it's not a heart defect, it's a heart disease. It's a disease of the muscle of the heart. And it puts him at risk for sudden cardiac arrest. So that's why I'm passionate about this work this month, because we have an AED that is at our house and goes everywhere with him to keep him safe and protected. It is most times genetic, and we didn't do genetic testing right away, but we have since done that and did find the gene that is associated with his heart disease. Because of his heart disease, we also have his 2 sisters are followed by cardiology as well, and we found a heart defect in his younger sister. And it's not the same as Jack's. So she has what's called silent PDA. It's an artery in her heart that is actually open. So many newborns have this, preemies, I should say, not newborns, preemies have this, and they will give them medicine after they're born to close that artery. Because all babies in the womb, the artery is open because they've received their oxygen from their mom, right? So the blood bypasses the lungs and receives the oxygen from mom. And then after they're born, that artery closes and everything's all good. Well, Allie, who's my youngest, her artery did close at her 3-month echo. Everything looked great and it was closed. And that her 3-year echo, that artery was open. So they believe what happened is that the artery closed like it was supposed to, but then scar tissue never formed, and now that artery has weakened and opened back up. So for us, there is a surgery that would go in and fix it, where they would insert a metal coil into that artery, and scar tissue would form around the artery, and then it would be all good. But with it comes all kinds of risk, right? So you're inserting a foreign object into her heart, and it's in a somewhat difficult place right now for them to get to, so it has risk associated with that. So the cardiologist told us that it's not like Jack's. This wouldn't be catastrophic. Her heart's not just going to stop. We'll have some symptoms. So I'm very passionate about everyone being aware of CPR and AEDs and how to use them and when to use them, and frankly, not to be scared to do it. So we're going to talk a little bit more about that today specifically, but I wanted you to know why this is important to me and why I'm just so passionate about that. So let's start with, because I think sometimes there's just misunderstandings. We all think we understand what these terms are, but let's just start and get everybody on the same page here. So we're going to define a few of our words we're going to be talking about today. Sudden cardiac arrest is not a heart attack. Sudden cardiac arrest is when the heart suddenly stops beating. It is different than a heart attack. And then we move into, how do you treat sudden cardiac arrest when that heart unexpectedly, and sometimes for no reason, might stop? So CPR is when you push hard and fast, creating those chest compressions to make the heart pump. And you can do this with or without breathing. So it's a lot more common for us to talk about hands-only CPR, because what we find is that bystanders are more likely to step in and respond and create that chain of survival if they're doing hands-only CPR. And we know that hands-only CPR does save lives too. So if you're thinking about that old school CPR where you have to give your 2 breaths, you don't have to do that. Hands-only CPR will save a life too. The AED, or the automated external defibrillator, is a device that really will analyze and look at the heart and the heart rhythm and give a shock if a shock is needed. Now, a heart attack is different than that sudden cardiac arrest in that it happens when part of that heart muscle doesn't get enough blood. Now, sometimes sudden cardiac arrest might occur after a heart attack or immediately after a heart attack, but those are 2 distinctly different occurrences that happen in the body. So let's talk a little bit about symptoms of a heart attack, right? So major symptoms could be chest pain or discomfort. Maybe someone's feeling lightheaded, weak, or they might faint. They might have pain in their jaw, neck, or back, or pain in their arm or shoulder, or one or the other, and shortness of breath. Now, the challenge is those could be symptoms for other things too. So anytime that those symptoms are present, we want to make sure that we're reaching out for medical care. So here's a little bit of a difference between that sudden cardiac arrest and a heart attack, right? So your sudden cardiac arrest victim will be unresponsive. They won't be breathing normally. They will need CPR or an AED. Now, a heart attack victim is responsive. They are breathing, and they don't need CPR or an AED. They might, again, be having that pain, that blood flow might not be occurring, but they will not be unresponsive. They won't be breathing normally. They will be breathing, but just those are the main differences between those 2 victims. All right, so let's go over the prevalence and survival of sudden cardiac arrest. So many times people don't realize that it happens a lot. And it's nearly 1,000 people every day in the United States that suffer from sudden cardiac arrest. And the survival rate is not high. There's a lot of contributing factors to that. One of them is timeliness. We know that for every minute after sudden cardiac arrest occurs, the survival rates drop without treatment. So that's why it's so important to start that CPR and get an AED immediately. The other thing is that, most sudden cardiac arrests are occurring outside of the hospital, and most of them are occurring at home. So according to the Sudden Cardiac Arrest Foundation, 1 in 10 victims of sudden cardiac arrest survive today. If bystanders would give CPR and use an AED immediately, we could up that survival rate to 5 out of 10. That's significant. We know that 7 of 10 sudden cardiac arrests happen at home. So the challenge is, these may be occurring when individuals are by themselves, and that obviously impacts our survival rates as well. And we also know, like I mentioned earlier, that sudden cardiac arrest leads to death within minutes if the person does not get help right away. And for every minute that passes, the survival odds decrease by 10% every minute. So it's so important to act and to act quickly. So how do we treat sudden cardiac arrest? It is an emergency and they need to be treated right away. That electric shock to shock their heart back into rhythm needs to take place. And to work well, that defibrillation, really we want to start that quickly and create that whole chain of survival. So what is the difference between CPR and an AED, right? So we talked about, most of us know that CPR is a method to manually pump that blood into someone's vital organs. And then in addition to that, to breathe air into their lungs. when their heart is not beating and they're not breathing. So those vital organs need to receive that blood. Otherwise, those organs begin to fail. So that's why, some survivors of sudden cardiac arrest, they will have long-term impacts depending on how long certain organs were without oxygen. So to keep that blood flowing to the other organs, it's critical that we start CPR right away. And in a moment, we're going to watch a video. We're going to show you how that hands-only CPR and the pumping and the compressions are so critical. Now, an AED, obviously we talked about, is that external machine, right? It's an external defibrillator, and it's automated to treat that sudden cardiac arrest. So it sends an electric shock into that heart to shock that heart back into rhythm and allow it to start up again, right? To its own, the electricity in the heart that's been impacted by that sudden cardiac arrest. Now I want to take a pause and show you a video that's going to show you really what you're doing when you're initiating that hands-only CPR. So bear with me for a moment here, and I'm going to get that started for us. All right, take 2, everyone.
Here we go.
Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
Okay, get back to my second. Okay. Make sure I've got my PowerPoint back up here for you shortly. Okay, so we've learned about the importance of CPR and those compressions. What I like to pause and say right now is that, many times when people hear the statement of ribs break and that's okay, I think sometimes that's what stops people or causes them to hesitate to step in and do CPR or to put that AED on someone, is that they're afraid they're going to hurt them, right? Or that they might break a rib or they could do more damage. And the reality of it is, if that individual's heart has stopped, you can't make it worse. You can only try to help. You can only make it better. Your effort gives them a chance, and that's what's so critical. So let's take a minute and talk about that AED and why you shouldn't be scared of it and how it works and what it does. So the AED has a few different parts. It's got complex programming behind the scenes, right, that make this all work, but it's a few basic parts here. And it's got the electropads, and those are the sticky pads that you put on the individual's chest. And the great thing about those pads and the AEDs is they really tell you what to do. It is meant for anyone to know how to use. And so the pictures will show you where to put it. The AEDs will talk to you. You shouldn't be scared of them. And it's not going to deliver a shock unless the shock is really warranted. So the electropads are there. You have the battery, right, that is storing that power and that energy. The capacitor will release that energy when it's time. And the processor, right? So that's the whole brains behind that. That's really analyzing a patient's rhythm and will determine whether the patient is in a shockable rhythm. So there's two forms of those rhythms that it's really looking to detect, and those cardiac arrhythmias or irregular heart rhythms. So it's going to look at those and determine whether a controlled electric shock should be delivered to the victim, and it will do that if that analysis warrants it. If not, it'll tell you that, and you can continue that hands-only CPR. So at the IPHA Heart Center Foundation, helping our communities be prepared for sudden cardiac emergencies has been a part of our work for a few years now. This is a map of the different counties that we have already placed AEDs in. We've placed approximately 125 AEDs throughout the state. The other great news is that the state of Iowa in the past years received a multi-million-dollar grant to place AEDs in all of our state trooper vehicles and emergency response vehicles that maybe didn't have them before. Until you get into this work, you don't really realize, like, our state troopers were driving around and they didn't have AEDs in their vehicle. And many times they're the first one to arrive at a scene and they wouldn't have had one in their car. So that is now happening in our state as well. So we'll continue to be more prepared throughout the state to respond to those cardiac emergencies. I just wanted to kind of close my presentation, the side of the presentation, and sharing other resources around sudden cardiac arrest. These are a few other organizations that have great information. The Sudden Cardiac Arrest Foundation, which I've already mentioned, and the Parent Heart Watch. Those two organizations partner together on a national campaign around Call, Push, Shock. And that has great information that you can share amongst your communities as well. The National Heart, Lung, and Blood Institute and the CDC have great, again, information on a heart attack, sudden cardiac arrest, heart disease, all kinds of things related to the heart, but in particular, sudden cardiac arrest. The American College of Cardiology has their patient education and outreach side, which is called Cardio Smart. And then, of course, the American Heart Association also is a great resource for information throughout your community on cardiac emergencies. I'm just going to put my contact information up here at the end to kind of close out my portion of my presentation here. And then I would really love to open it up to questions you might have about anything you've heard today. I also, as I started with my own personal story, I would welcome anyone to share maybe an experience that they might have had personally with heart disease or cardiac emergency, and what your story is that you'd want to share to inspire others today too.
And feel free, anyone, to unmute, turn your camera on, put it in chat, whatever you're comfortable with.
I can share my story.
Thanks, Mary.
Sure. My husband suffered out of hospital cardiac arrest almost 2 years ago, and he had CPR only for at least 11 minutes from when we found the 911 call to when. So I have a couple points. Sheriff's deputies, 4 of them showed up all without AEDs. So does Dallas County have? I have an email into them right now as you started. Do they have AEDs in their cars yet?
They should be, it's my understanding, they should all be receiving them in this phased implementation of the grant that was received from the state. I know we've had requests from Jasper County recently too. So I need to follow up and see where the state is at in actually implementation. And phase 1 is going to state troopers, phase 2, what's next. So I will follow up on that, Mary, and I'm sure that I can, you have my contact information, hopefully.
Yeah,
I can back up if we need to.
Yeah, and
yeah,
sheriff letter.
It's shocking, right?
Pardon me?
It's shocking that they didn't have them, right?
Yeah,
many of us just assume it's there.
Right, 4 showed up all without AED. So it was, and they started. He was playing soccer, and so most of the guys that were playing soccer, there were most of the people, because it was guys and girls, men and women. They are high school soccer coaches, so they initiated CPR right away. And that's the only reason why he survived. But he survived and was out of the hospital, but he had no symptoms, no heart attack symptoms before. He just flatlined. And so yeah, you brought up about the sheriff's deputies. Oh, and then the breaking ribs is when whenever people talked about it, no ribs are broken. And he even got into that machine that does the CPR for you. I can never remember the name of the machine. And so whenever people came to the hospital, Lucas device. Yeah. So when people came to the hospital afterwards, they just said, he has no broken ribs. That thing was violent. But yeah, again, the alternative was that he would have been dead. But they, and another thing as far as mouth to mouth, is that they were doing mouth to mouth. And then this 911 operator said, just stop doing mouth to mouth and concentrate on the pump compressions. So, but so CPR saves lives. And one of the guys that was giving him CPR, I certified him after the event. He was not certified, but he was a school teacher and they were teaching CPR in his class and he's just observed. So, so even if you don't know it, just push hard and fast. So right. I loved your presentation. I told you I lived through every step of everything that you said. I've experienced it all with our incident. So thank you very much for doing this and your work.
Oh, well, Mary, thank you for sharing your personal story. And I'm glad that you had a positive outcome because we need those, right? We need them all to be positive and we need people to share their stories so that people are not intimidated by CPR or scared of an AED. So that's why we're here today, right? Is to make sure that all of us know that we have that power to save someone's life, even if we're not certified in CPR. That's a hard story to follow, but I understand if everyone's hesitating, but if anyone does have more comments or questions, I'm here to take those too.
Leslie, I have a question that's kind of related to the work that you're talking about doing in school and the programs that you're implementing. Are those required or by school, or is it just whether or not a school elects to participate? And what's your work doing to, if not required, to kind of get it in there?
So every state has a different law around CPR requirements, right, for graduation and AEDs. I will say that Iowa does require CPR as part of graduation requirements. Now, I say that they do require it, but it is not that the students need to be certified. So they're at least required to have had exposure to CPR training and CPR education before they graduate high school. So that is taking place in one way, shape, or form in the schools. We have done where we've gone into schools and done those as well. We have some outreach that we're trying to work on around college campuses too, because we know that that's potentially a gap on those campuses for those students to feel comfortable and ready to respond in a cardiac event. We went and did a presentation with Iowa State students and had a survivor come, and she told her story too. So it's important to get that awareness out. But in Iowa, we do actually, it is a high school requirement for that CPR, but it's not that they necessarily need to be certified or even go through the practice of it. They just need to, have received education on it. So there's always more that we can do around that. We're working right now with an organization called Aviv. That was one of the resources you would have seen on there, or Aviv, they call it, sorry, it's pronounced Aviv. And they are really piloting a new AED. So they have created, 2 MIT grads created a new, smaller, more portable AED device. And they have 6 cities that they're piloting what's called the 4-minute city project. And so they are wanting those AEDs to be within 4 minutes of any cardiac event. And it's incredible, the technology going into this, right? And so these AEDs, and they are working in partnership with the 911 call centers and emergency dispatch. So dispatch would be able to see where the nearest AED is when they get that call. So like my home AED, for example, I would choose, it would be the consumer's choice to opt into this. And then my AED would wake up and start talking to me when the 911 dispatcher says, a cardiac event is occurring near you. You are the closest AED. Please take the AED to that event. So then you would get the GPS and the address to send and to take your AED there. So I could be responding before maybe the emergency responders are able to get there. So there's just some great work happening right now around making our communities more prepared in the event of those cardiac emergencies. And so we're constantly looking at those partnerships that we can bring to Iowa too. We were not selected as one of the 6 cities for that, but we have conversations that they'll be coming in and we'll be holding a stakeholders meeting for other partners throughout the state to really talk through how this can really come to fruition here in Iowa.
So what if someone has a blood clot in the heart and then you started pumping again? What are the chances of the clot kind of moving on to the brain or lungs?
Well, every single case, right, has all kinds of different odds. So what we do say to all those bystanders is that until those emergency responders get there, you are that person's best shot if their heart has stopped, right? So if we're afraid of pumping and doing compressions and moving and forcing and pushing a blood clot around, the fact of the matter is if their heart has stopped, their heart has stopped. And so they are in fact dead. I mean, it's called sudden cardiac death, right? So we just don't want people to be afraid of all the other scenarios because there's so many other scenarios that might be occurring, blood clots and others. And that is for those emergency responders and doctors once they get to the hospital to be able to treat and look at. But if we don't start CPR and we don't start those compressions, that person is already dead. So I can't speak to an individual case of blood clot in the heart and what we should do, but if the heart has stopped, we need to be doing CPR. If the heart has not stopped, and we think they're experiencing some kind of a heart attack, then we need to get still that emergency, call 911 and get that treatment started. But sudden cardiac arrest is when the heart is stopped. So we need to get those compressions started right away.
Thanks.
You bet. Thanks, Joanne. Hi, Beth. It looks like you unmuted.
I did. I have a question.
Sure.
And this is kind of the afterthought or afterwards, but what is available, or how do you work with individuals to overcome the anxiety after, whether it's a heart attack or whether it's that cardiac arrest? The folks that I deal with are very scared, nervous,
Sure.
anxiety.
Sure.
What's out there to work through that?
Right. The mental health aspect of this, obviously, I mean, I deal with it with my 10-year-old son. He's asking me, I mean, as young as 6 years old, he's asking me questions of like, well, what if they can't start my heart again? Right. And as a mom, that's a tough question to answer. I completely understand this mental health side of responding after they've had an event or a heart attack or disease. So that's where that complete care comes in, and we really want to talk through how we can best set them up for success afterwards, right? And that's what cardiac rehab is so important for individuals after they've experienced a heart attack and after they've gone through an event. So we want to make sure all patients are getting their full treatment of cardiac rehab so they can understand the importance of exercise, the importance of diet, all of those contributing factors that we know can reduce their risk of an event. Case by case, I mean, after someone has an event, there's going to be a whole workup on them, right? To understand maybe why. Now, sometimes we don't ever know why, but sometimes afterwards, we'll be able to see, was there damage to that heart muscle? Was there scarring that now occurred, or other areas of that heart that are now not functioning, and how do we treat that? So that's where it's really important to have their care team and to ask all those questions so we can help reduce that anxiety. Some patients will realize and come to understand that maybe they have what my son has. Maybe they have hypertrophic cardiomyopathy and that's why their heart stopped. Well, if need be, then maybe they're going to have an internal, an ICD, an internal defibrillator installed, right? And put in. There's lots of different things that will go into those conversations, case by case, person by person, of what impacted their health and then what the road to recovery looks like for them. So it is absolutely normal to be scared. And I think that's just the great place to start with, that like, it's okay to be anxious and it's okay to be scared, but let's start to understand how we can reduce your risk and then help you build out some coping skills to help you not feel scared. Right. And I think education and knowledge around risk factors and the things that they can control. Right. There's things in life that are not in our control, but of the things that are in our control, where can we start and to help them reduce that anxiety? I hope that helps, Beth, to start with where to be. There's some great resources at the places that I just put out there. And then I'm happy if Lena wants me to put together a few of these links to some patient resources that might be helpful for everyone too.
That would be helpful. Thank you.
Yeah, you bet. I'll get that sent to Lena.
Leslie, that'd be great. And we can attach them to the video when we post it to YouTube.
Sure. Yep. I'll get those out.
I have another question that kind of follows on what Beth was talking about with the anxiety and the kind of the mental health side of sudden cardiac arrest. And I'm wondering what you say to those who have performed CPR or have done the AED, regardless of the outcome. I mean, that just the act of performing CPR, of being the responder, can be a traumatic event for people, and especially if the person doesn't survive. What does your foundation have resources to people who have experienced that side, the responder side, and is there other resources available to people that kind of are reliving that?
Right. I'll try to put some out there. I'll be completely honest with you. There's not as much as there should be. There's not. Both on, those that have survived and haven't survived. Either scenario, right, is triggering and traumatic. There's definitely not as many resources out there as there could and should be. But there's also some really, I think what the common denominator that I usually see is that there's a connection that occurs when that individual survives. And I think that many times the person who was a part of that chain of survival and the person who survived, they help each other through it. That's what I see most common, is that they shared that event together and they actually help each other many times. That's probably what I see most often. But I'll send, there are a few things out there from some of these organizations that I talked about, but I would say that just like every other area of health, that mental health side of all of this, right, is lacking across the board, just like it is with other things. So I'm definitely happy to send what we have, but it needs work. It needs a lot of work. And Mary, maybe you want to jump in too, but that's what I see a lot, is that those individuals that contributed to that individual surviving, that connection usually is what helps each other through it sometimes.
Yeah, my husband had a close relationship with, and they had been playing soccer with the same people for about 25 years. So, but it took a couple, the two main people that gave him CPR, it took them coming to the hospital and seeing Mark alive for a little bit of, closure, and seeing is believing, what they did. And then Mark now does go back playing soccer with those people. And it's like, so who was more nervous when you're going back, the team or you on his first day back? But actually the two guys that, the two guys that gave him CPR got Heroes of the Heartland from the Red Cross. And so when we went back to video, the ceremony or the things for the award, he got to see everybody. And it was really, I think it was really good that they all got to see. It put a little bit of therapy in it, that everybody was there to I don't want to say closure, because it's still kind of ongoing, but I've had some friends, again, because I'm a CPR instructor before this, that have given CPR, and they say that sometimes they're taken off in the ambulance and there is no time. You wonder what happened if they did live afterwards. And so I know that, so I have researched it, and there is not a lot of support, because of my incident, and then as well as my friend's previous incidents. So yeah, that is something that I think needs to be found, and not just them, the survivor, but also the people administering. So great question, Lena.
Always lots of work to do, especially around mental health.
I'll chime in with a question real quick. So we've talked a decent amount about how whether you're certified for CPR or not, you can do a lot of good. But if somebody did want to get certified, maybe they want to do, they want to help get maybe their workplace certified, their household, a group of friends, family, other people that they're with a lot. If you want to get certified like together or something, how could somebody go about helping make that happen? Is there somewhere you can go? Can you call, bring somebody in? How would somebody go about that?
Yep. So there are, there's BLS classes that like we're required to do, because we work in even though I'm not a nurse, even because I work in the building here, I have to have those basic life-saving skills. And there's also CPR classes. There's a number of options out there. There are online ones that you can do, and then you would take the class online and then go to a site and be observed and certified. There's local classes, individual and group, that can come to your workplace too. There's a few different options out there. I'll put those direct links when I send that to Lena as well, because we have not been doing as much here right now. We've just found that there are other organizations that are already specializing in it and do that. Our nurse that was on staff just took a new position at Mercy One at Iowa Heart. So we're hiring. So that's a plug for we're hiring right now for a program manager, if anyone's looking or anyone within their network is. But yeah, I'm happy to send that to where they can find it in their local community, because obviously it varies throughout the state. But there's some great resources they can look up by their zip code to find the closest CPR classes.
I don't know if it's still there, but I think the American Heart Association had a kiosk for hands only in Jordan Creek Mall. So that's a great thing to go practice. It gives you great feedback. I don't know if you want to talk about that, Lezlie.
Sure. Yeah. So Mercy College of Health Sciences partnered with the American Heart Association, and out at Jordan Creek Mall, there is a hands-only CPR kiosk. So yes, you can go and actually just practice and try it out, right? That's the nice thing about CPR and why you want to do it with someone that can give you that feedback. We have devices that when we're doing the CPR, just like you saw in the video that showed you, like, are your compressions deep enough? Are they too fast or are they too slow? Just to like go through and do it one time. And even though honestly that I've been certified multiple times, each time it still makes me a little nervous. And I just sometimes need to like have that reassurance. Okay, I'm doing my compressions at the right rate. I'm going deep enough and I'm giving that, the heart and the chest, the recoil, all of that. So it is a great opportunity if you're ever just out and by. It's on the lower level. Lower level out at Jordan Creek. And you can stop by and it'll give you that feedback and you can just practice hands only and those compressions. There's not very many that I'm aware of. So if you're in the Des Moines area, I know that that's at least one available to us here.
I did not know about that. That's pretty cool. I'll have to go try that. Yeah, I think the hands-on practice would be.
Hasn't been there. It's less than 2 years that it's been there.
Okay. Yeah, I think the hands-on practice would be nice. Give people kind of a peace of mind. I was surprised to hear that for the high school certification. I'm glad that it is required some amount of CPR training to some degree, but I'm surprised that the practice isn't necessarily required.
Right. Yeah. Every state in the US is at a very different place in what's required and what's not required. Right. And sometimes, a law will be put in place, but resources aren't there, obviously, to support it. Right. So then it's up to the schools to figure out, how do I incorporate this? And is my health teacher even qualified to deliver it, or is the nurse going to come into? So there's no standardization in the delivery of that CPR education in our high schools, but it is at least required in Iowa.
Well, thanks both of you for the answers.
You bet. So I'll close with, I think we're probably coming to the end of questions, but I'm going to close with a challenge for all of you, is to share with someone that you know that before the end of the month, that October was and is Sudden Cardiac Arrest Awareness Month, and thank those individuals that step in and save lives every day, because every single person on this call today has the power to save a life. We all have that ability to do it. And I just encourage you to be brave. And if you're ever with someone that is experiencing that cardiac emergency, is to know that you can save their life and it is in the power of your hands, and just to start those compressions and call 911 right away.
All right. Thank you, Leslie. If anybody else has any other questions, feel free to chime in, interrupt me. But otherwise, thank you, Leslie, for sharing your expertise with us today. Thanks to everybody here who came and shared your lunchtime with us. We hope that you can join us again next month. I think it'll be on the 18th. We'll be joined by Mary right here and Patty Quinlisk, who will talk to us about preventing dementia. We have one more spot for 21 and 22 Lunch and Learn season. I think it's in February, but don't quote me. You can go back and check the calendar in the email we sent this morning to make sure. I think it's February. If you're interested, or if you have anybody else you think might be interested in sharing their work, you can email me at brett@iowapha.org to get that set up. So just a reminder, as a nonprofit organization, IPHA relies on membership dues and sustaining donors to support our missions. If you're already a member, we appreciate it. If you're not already a member, please consider joining. And if there's any students here, you can check with your department chairs. Some programs have funds to help support your membership. We appreciate any donation that fits within your budget. You can join and give at iowapha.org. You can find the recording of this Lunch and Learn and any other on our YouTube page, Iowa Public Health Association, and you'll find any other webinars that might be archived there. With that, thank you. We hope to see you again next month.